So today we'll begin a simple primary care review in diarrhea in children. Review. The World Health Organization defines diarrhea as the passage of three or more loose/watery stools per day. Acute diarrhea lasts less than 5 days. Causes. Virogastroenteritis. It is the most common diarrheal disorder where 60% of all cases of diarrhea is identified as viral etiology among 2 months to 2 years of age. Bacterial enteritis. It affects children older than 2 years of age and occurs through oral fecal contamination. Antibiotic associated diarrhea. It occurs commonly with many antibiotic use, including amoxicillin, cephalosporins, and clindamycin. Functional diarrhea. It can occur with an increased intake of hyperosmolar fluids, such as fruit juices in toddlers and young school children. Starvation stools. It is diarrhea occurring in malnourished children or in well-nourished children with acute viral gastroenteritis who are only given clear liquids during the course of their illness. Lactase deficiency diarrhea. It occurs in younger children caused by mucosal injury from an enteric infection, such as acute viral gastroenteritis. Clinical evaluation. Patient's history. Immunocompromise increases the risk for infections with unusual organisms. Fever and bloody or mucose diarrhea may indicate certain bacteria infections. The duration of diarrhea. Travel history, more likely to have bacterial or parasitic pathogens. Recent antibiotic use, and dietary history. An example would be diarrhea in patients taking large amounts of formula or fruit juices suggests overfeeding or functional diarrhea. Physical examination, generalized toxicity, and dehydration evaluations, which would show decreased urine output, tachycardia, and dry mucous membranes, delayed capillary refill time with a greater than 2 seconds, which would show dehydration. Laboratory testing and imaging. Common viral gastroenteritis doesn't need any laboratory study. Persistent diarrhea may order stool studies, stool culture, ova, or parasites. Management. Most children with diarrhea will not require intravenous fluid repletion. Treatment with oral rehydration solutions should be the first line of therapy. Antibiotics should not be used routinely for well-appearing children with acute bloody diarrhea. Antibiotic therapy may be a risk factor for the development of hemolytic uremic syndrome in patients with bloody diarrhea due to E. coli. Probiotics appear to have only a modest effect on recovery from infectious diarrhea. Thank you.